by the Director of the Department of Public Health, Dr. Grant Colfax, the Director of the Department of Emergency Management, Mary Ellen Carroll, the Police Chief, Bill Scott, the Director of the Human Services Agency, Trent Rohr, and the Director of Homelessness and Supportive Housing, Abigail Stewart-Kahn. Thank you all for joining us here today. As of today, May 4th, we have 1,624 confirmed cases of the coronavirus here in San Francisco. And sadly, we have lost 29 people to the virus here in our city. If you want more information, you can please visit datasf.org/COVID-19. It's our tracker with detailed information around testing and other helpful information by zip code that people may be interested in seeing. Today I had a couple of things I wanted to talk about, specifically the new health order issued on Friday by our county health officers. I mentioned this on Friday, but I think this is really exciting that even though we still have challenges that exist, the ability to allow people to get back to work is so important. And construction in our city will be allowed, as well as outdoor businesses. And today, I just want to express again my appreciation, the outdoor activities, the outdoor businesses, and how important it is to make sure that we start to gradually get back to business. We know our governor announced a plan that he will release on guidelines as well as timing of when some of our small businesses, our bookstores, our small retailers can get back to work. And I think it's important that we provide some guidance. To be clear, the whole point of the health directive has everything to do with limiting our ability to be in contact with people so that we can avoid not only transmitting the virus or contracting it ourselves in the first place. The ability to do that is critical, but we also realize there are a number of people out there that are struggling financially. And if there is a way to accomplish the public health goal of keeping people safe with also allowing businesses to operate, but to operate differently with certain guidelines, I think that we can definitely work together to achieve that goal and get to a better place. In fact, this weekend, I spent a lot of time in a lot of neighborhoods all throughout the city. And there was a flower shop on Chestnut that was open and available because it's considered an outdoor business. I don't remember buying flowers and being even happier than I was when I was able to stand in line and wait at a 6 feet distance for the customer in front of me. I probably waited 30, 45 minutes and I didn't even care. I purchased flowers and I was so happy to purchase these flowers that in my house, I take them with me, whatever room I decide that I'm going to be in. That's the room that the flowers will travel. And it's just, you appreciate things a lot more, but also I was so happy for the business that was able to open. And when I looked around the area, I thought with some of the retail businesses and other places, why can't they do the same thing? They weren't allowing any customers to come within within their shop area. It's an open outdoor flower shop. There was a divider up and a gate, and there was no way anyone was entering the business, but the ability for people to stand in line and purchase and get flowers was absolutely incredible. And the good news is, in this health order that was just issued, florists in this city are finally able to continue the work that they do to deliver flowers just in time for Mother's Day. So I hope many of you will take this opportunity to either go online or call your local florist and put in an order for flowers, not just for this weekend for Mother's Day, but just in general, because we want to continue to support that industry. We know flea markets will be open again. You'll see food trucks And I just want to also say, with food trucks in particular, oftentimes it's either one or two people who are working in these food trucks. They don't have the ability to manage a line. So again, this goes into, asking everyone to be supportive of maintaining your distance, wearing your mask, and being respectful of one another. So that we can not only continue to allow street vendors and all these other great things, our florists, our gardeners and landscapers and people who have outdoor businesses, we want them to stay open, and the only way we will allow them to stay open if people follow the rules. So as we look at other opportunities to, as we said, allow non-essential businesses like our bookstores and our retail stores where you can buy clothing or toys for kids or things of that nature, as we start to look at those opportunities, we're going to be paying close attention to what we've already allowed. And if we're not able to manage and maintain those with the distancing requirements, it's going to be very, very difficult to start to get back to business. So I just want to express my appreciation to all the small businesses out there, and also an understanding that we know you're struggling, and it's going to be important for us to look at and implement new guidelines, but to also make sure you're able to get back to business without compromising the incredible gains we've already made as it relates to flattening the curve, not reducing the curve, but being able to keep it somewhat flat. We still see the number of deaths go up. We still see the number of cases go up. So we are by no means out of the woods on this, but we also recognize that there is a possibility to provide opportunities for our small businesses to open safely with certain guidelines, and we will continue to work with the governor and work with our public health officials to try and do it in a responsible way, and we appreciate your patience and your cooperation. And, again, as I spend a lot of time in a lot of different neighborhoods all over the city just to get a feel for what was happening in the Castro and by the beach and in other places, I did notice something that really was very upsetting, and that is the number of people who were not socially distancing themselves at Dolores Park. Dolores Park continues to be a real challenge because we know that on nice days, that is the place to be for so many folks. It's a great place, good energy, good weather. But unfortunately, again, we had a real challenge with people who were coming together in groups and not socially distancing themselves from one another. And the folks who are our park rangers and other security, they really had their work cut out for them. And the fact is, we're all adults here, and there's no reason that we should have to send in any of our law enforcement or anyone to tell people what they should be already doing. And so I bring up Dolores Park because we are going to be monitoring. Today is a nice day in San Francisco, and our goal is to monitor Dolores Park within the next couple of days. And if we see that behavior has not changed, we will close the park. And I want to be clear, this is the last thing I want to do. We know that people need fresh air. They want to be out, but if we continue to see that behavior become problematic at Dolores Park, it will no longer be available. So I'm asking everyone to be cooperative and to make sure that they're following social distancing. People are wearing their mask when appropriate to do so, so that we are able to continue to enjoy this incredible open space. And again, making sure that we do our best to enjoy open space within our own neighborhoods. The other thing I want to talk about that I think is important is the fact that street cleaning has been a problem. And people are not moving their cars. And what we've tried to do with the public, because there are certain people that may have contracted the virus and can't leave their homes, certain elderly people who, for whatever reason, can't move their cars, and we were sensitive to that. But there are a lot of able-bodied people who are able to get up and move your car. And the problem that we're having right now, a lot of folks are not doing that. And at a time where we need to clean our streets the most, we don't have the luxury to allow this to continue. So again, here is another warning. Not only will we start to implement ticketing around street cleaning, we will look at other ways in which we can address this particular issue if we don't see a change. So for those of you who are able-bodied and are not sick and can get up and move your cars for street cleaning, I'm asking you to do that, because otherwise we will have no other choice but to begin to implement, re-implement our ticketing procedures around street cleaning before our orders expire. I'm counting on all of you to cooperate and to understand that, there is a need, to make sure that we keep our streets clean. And the fact is, we have people who are out there cleaning the streets, but passing blocks at a time because people are not moving their cars. This is a real problem, and it's one that we can't continue to tolerate. So we're going to monitor the situation very closely around street cleaning this week, and we'll have an announcement if we think that nothing has changed to provide a plan of when we will be going back to ticketing. So do us a favor and let's all join in keeping our neighborhoods clean, and that involves making sure that you move your car for street cleaning. I also want to talk a little bit about our testing expansion for essential workers. And as you know, what we are doing as we get the materials that we need and the testing capacity, we know that based on the tests that we do, whether or not we can expand those opportunities to more and more people, the ability to expand testing capacities is so important as we start to look at opening more businesses and reopening our city. Having the ability to get people tested is so critical to that success. And today, we just want to announce that we are able to test all essential workers, whether they exhibit symptoms or not. And this is definitely significant. This is really a game changer here. The ability to allow grocery store clerks, our muni drivers, and other people who are on the front lines, our firefighters, police officers, and nonprofit workers who are working with our homeless population in the shelters. If you are an essential worker and you exhibit symptoms or you don't exhibit symptoms, you still are able to get tested. And usually the results of those tests we get back anywhere between 24 and 72 hours. And so we want to encourage those who would like to be tested. If you think you've been exposed or if you think you exhibit symptoms or not, please go to sf.gov/citytestsf. We have several locations where we're doing testing, including Zuckerberg, San Francisco General, the Castro Mission Health Center, the Southeast Health Center, and the Maxine Hall Health Center in the Western Addition. Now, we don't want you to just show up to those test centers. We want you to sign up, and you will be directed to a specific location to be tested. And this is going to make a world of difference in ensuring that we are aware and we keep the public safe. But I just want to remind people that just because you get tested doesn't mean that you're out of the woods. We still need you to socially distance yourself from folks. We still need you to follow the order, because you could be tested negative today and 2 days later come in contact with someone and later on be tested positive. So it doesn't mean that you're completely clear if you test negative on these tests. And this is in no means a substitution for wearing your mask and socially distancing yourself from other people. And the other thing this doesn't do is tell you whether or not you had the virus. So again, if you think that you might have the virus and you've been in contact with people that might have, or you exhibit symptoms, please reach out to us. You can call 311, or you can check on the website that I mentioned earlier. I also want to talk a little bit about our new testing policy at our skilled nursing facilities, which you have probably all heard about already. Our goal is to try to focus on many of those congregate living settings where we know are the most vulnerable populations. And starting this week, we will begin a new program to test all residents and staff at Laguna Honda Hospital, the city's largest nursing facility, and we'll be issuing a health order requiring universal testing at the 21 private skilled nursing facilities in San Francisco. So we are taking the lessons that we learned in responding to Laguna Honda and how we address that outbreak to make sure that we are supporting other nursing facilities in our city, whether we are directly responsible for it or not. It's important that everyone ensures the safety of not just the workers who work at these skilled nursing facilities, but the patients as well, who are amongst what we know are some of the most vulnerable when it comes to COVID-19. And this is really an incredible step forward. And as I said, as our capacity increases for testing, we are going to continue to make sure that we're focusing on areas where we know need it the most and prioritizing those areas. And I also want to be clear that any member of the public, whether you have insurance or not, whether you're documented or not, you can also get tested if you exhibit symptoms. So please don't let that be a barrier to your concern about your health. We are here to identify anyone who is COVID positive so that we can proceed with either making sure that they are quarantined and protecting other members of their families and that they have a place to actually quarantine. This is our priority, insurance or not, for anyone who's in San Francisco who exhibits symptoms. Again, you can visit our website or call 311. The last thing I want to mention is something that I'm very concerned about, and that is people, again, who I've mentioned before, people who are not law enforcement treating other members of the public like they are law enforcement. We do not need people to get into altercations with their neighbors or with other people because they don't believe they're following the direction of the health orders. So for example, I've seen a lot of notices and a lot of concern that people have expressed about runners who are not wearing masks. And the fact is, if you are running outdoors, you're not required to wear a mask. And I know that everyone thinks that runners who are outdoors running should wear a mask, but our guidance for who should and shouldn't be wearing a mask is coming from our health department. And I'm asking you all to follow the guidance and, again, focus on yourself and what you're doing and make sure that you're wearing a mask, you're keeping your distance, and you're protecting yourself and your families. And please do your best to not try and inflict or police other people, especially when you are communicating the wrong message about what the order is or is not. That creates a lot of tension. That creates a lot of negativity. We are all struggling with this. We're all in the house, and we don't want to be there. I'm sure many of you with kids, your children are probably driving you crazy right now. Everyone's having a tough time. And so the last thing we need are people who think that they're the coronavirus police and they're here to tell everyone what to do, because when you do that, it creates drama, it creates tension, and we know that not everyone is following the rules. We understand that it has been challenging in some neighborhoods more so than others, and that really probably frustrates us all to no end. But I ask that you, again, focus on yourself and let us do our job to try and address some of the other challenges that exist, especially because in some instances, inaccurate information is being provided as it relates to face coverings. And I again want to focus on the fact that you can wear a mask or something that covers your nose and your mouth as a face covering. It doesn't have to be a mask. and you don't have to wear it when you're outdoors unless you're in line for an essential business. So I just wanted to remind the public that I get that these are challenging times, and all of us want to get out of this, stay-at-home order as quickly as possible. First of all, we get through it by staying focused and following the health orders ourselves. Second of all, we get through it by making sure that we are not engaging in really divisive and negative behavior that could make this order prolonged or worse. We are really in this together, and what impacts one community impacts us all. And we know that as great as San Francisco is doing, especially those who are following the health directive, we know that not everyone is doing it, right? We know that there are some people who, for various reasons, are not following the health directive. And I know that in some cases we've had businesses that the police department have shut down. They've tried to implement social distancing in various neighborhoods where we know we have problems. And as we see the problems persist, we'll make adjustments. So I ask again for your patience, your cooperation, and I want to thank all of you for continuing to support these health orders. Just know that we are in a better place and we want to stay there, and we are mindful of the need for so many people to get back to work because their livelihood and the future of our city is counting on it. And so we hopefully, after the governor's guidelines are issued, will have some even better news to announce to get our city back to where we know, even though it might be a lot different when we start to reopen businesses and our restaurants and other places, we got to start somewhere. So thank you again for all of your cooperation. And at this time, I'd like to introduce the Director of the Department of Public Health, Dr. Grant Colfax.
Thank you, Mayor Breed. Good afternoon. I'm Dr. Grant Colfax, Director of Health for the City and County of San Francisco. Today, there are 1,624 San Francisco residents with confirmed cases of COVID-19. And sadly, 29 San Franciscans have died. I send condolences to their loved ones, friends, and community. As of today, 25,165 people in San Francisco have been tested, and an average of 9% have tested positive for COVID-19. We have made significant progress toward our goal of universal access to testing for all San Franciscans, and that is what I would like to focus on today. But first, I want to acknowledge that today is the first day of our new regional stay-at-home order for Bay Area residents. And as we embark on the month of May, for some of us, it is with mixed feelings. While the data show that most people support ongoing and aggressive efforts to slow the virus, it isn't easy for so many of us to do so. Believe me, I know. Not only because of how I feel at times, but because of the phone calls, the Zoom meetings, and emails and other communications that I get every day. I share the frustration. I share the concern. We are restless. It has been 6 weeks of staying mostly indoors, and as the weather grows nicer and summer beckons, people want to get outside and rejoin society. we miss our friends and family. Our coworkers, and our normal lives. We are anxious. For many San Franciscans, the emotional and economic stress of the situation is continuing to build. For parents who are homeschooling and workers with no paychecks, there are serious consequences to the shutdown. Yet, I feel, and we also feel, pride. San Francisco has done a tremendous job, and it is thanks to all of you that this crisis is not worse. We have built an impressive response infrastructure that was not there before. And now we are using it every day to continue to fight the spread of the virus and to protect our families, our community, and our most vulnerable populations. This could not have happened without each and every one of you doing your part. And at the same time, we feel cautious. Even though we have made real progress as a community to slow the spread of the coronavirus, it is still here. It can still spread easily as it did a month ago, and it will thrive as we let it. So despite our frustration, our concern, our anxiety, we must lead with firm determination. San Francisco and the Bay Area, let's use the month of May to solidify our gains as much as possible. We have saved lives, reduced harm, and we must keep up the good work. Let me assure you, there is reason for hope. As this new health order takes effect, I'd like to point out some ways that life will get a bit better right away. Basically, we are opening the outdoors as long as we can do it safely. And believe me, I find this personally welcome news. Food trucks, flea markets, construction are back. We can send flowers to our mothers on Mother's Day because florists can deliver again. I highly recommend sending flowers to your mother. Speaking of flowers, plant nurseries, gardening, and landscape businesses can reopen. Those are just a few things I am looking forward to, with social distancing and face covering, of course. And as the mayor said, we are working very hard to find ways to continue to open more businesses and activities safely while sustaining the progress we have made. With guidance from the CDC, the state, and local health and business leaders, I am confident we will determine how and when opening responsibly and safely and as quickly can be done. Now, I would like to talk about testing and reinforce the mayor's remarks. Indeed, we have exciting news on this front. As San Francisco has announced, our vision, our goal, is universal access to testing for all. To achieve this, we've continually expanded testing based on where the need is greatest and the availability of resources. First, we focused on testing people with symptoms among travelers, in outbreaks, vulnerable populations, case contact investigations, and among essential workers. And we reached the point where we can test everyone with symptoms and respond to the testing needs of outbreaks. This was significant progress. So now we continue to expand. As the circle keeps widening, we can now test more people without symptoms. We first added close contacts without symptoms. Then, as the mayor said, last week we announced that all residents and staff of skilled nursing facilities would be tested as well. This is a key vulnerable population, and it was key that we expand testing there as quickly as possible. Today, the mayor has announced that all essential workers in San Francisco are eligible for free tests, regardless of symptoms or exposure. The message is, if you are going to work during the stay-home order because you are an essential worker, you can get tested, regardless of symptoms. Essential workers have been showing up every day. They are healthcare workers, first responders, grocery clerks, construction workers, drivers, child care workers, and others who continue to leave their homes to serve our city during this challenging time. These essential workers interact daily with other people and cannot always easily maintain social distance by staying home. For these workers, they can decide when they want to test, but it is important for them to test immediately when they feel ill or have symptoms consistent with COVID-19, or if they believe that they have been exposed to COVID-19, or if they are otherwise concerned and wish to be tested. No doctor's note, no healthcare provider's note will be required, and the test is free. I encourage essential workers who want testing to start with their own healthcare provider. We are recommending that all private providers make universal testing available to essential workers. This will be the best way for people to stay connected to care. And also, starting today, essential workers can get tested for free at one of the 2 City Test SF sites at the Embarcadero and Soma. These 2 sites alone have the capacity to test 1,500 people per day. The department's community test sites are also providing free tests at Southeast Health Center in the Bayview, Castro Mission Health Center in the Castro, Maxine Hall Health Center in the Western Addition, and Zuckerberg San Francisco General Hospital in the Mission. Appointments for these tests are still necessary in order to ensure social distancing and reduce lines. If you want to schedule a test, you can call 311 or visit sf.gov gettestedsf for more information. It is good to have come this far, to be able to provide universal testing for all residents and workers at all skilled nursing facilities, and to announce today that all essential workers can be tested, regardless of symptoms or exposure. Testing is a key component of our overall recovery. I am grateful to the team of the health department, including the teams of Dr. Susan Phillip and Dr. Amy Lockwood, for expanding our testing capacity in an unprecedented, rapid fashion. To the port, especially Port Director Elaine Forbes and her team, the University of California, San Francisco, and our many other partners in the private healthcare system and the community for pulling together to make testing more possible for San Franciscans every day. We will continue to build our testing program. We plan to expand testing to shelters and other congregate settings, and to expand testing options in communities that are most impacted by health disparities, economic inequality, and discrimination. But remember, a negative test is just an assessment of your status at that time, at that moment in time. It does not mean you are immune, and it does not mean you are protected. Testing is important, but it is just as important not to get sick or exposed to the virus in the first place. So please, continue to take precautions. We must all continue staying home, continuing to cover our faces whenever possible when we go out, and continue to keep 6 feet away from people outside of our households. If we do that, when we do that, we are in for better times. Thank you. And it is my pleasure to introduce Chief Bill Scott, a key partner in our COVID-19 response.
Thank you, Dr. Colfax. I'll begin my comments and my remarks with the way I always do, and that's thanking our Mayor London Breed and Dr. Grant Colfax, our Director of Health, for their continued leadership during this very challenging time. So I'd like to start with what happened over the weekend, and I'm going to start with basically reiterating some of Mayor Breed's points. You know, although we're generally pleased with what we're seeing as our city and San Franciscans continue to shelter in place and abide by the public health orders, we have seen some issues that merit repeating. And I'll start with piggyback on the mayor's comments about Dolores Park. We anticipated that we would have more people out this weekend with good weather, and we've had some relief with the new public health order. We anticipated that, and we actually put out more officers and more volunteers and work with other city entities in anticipation. But Dolores Park and other popular parks in the city, we cannot let up. Now, it is okay to go to the park and be with members of your own family. Make sure that you have your face coverings with you as the health order calls for. What's not okay is to be in large gatherings of groups with people outside of your household. That is still not okay. We are asking that you continue to social distance, but what we're seeing in Dolores Park and some other parks is that people are having picnics in large groups, and some of those groups go outside of the household. We're not at a point where we're relaxed to that level yet, so I want to remind everyone of the mayor's words, of Dr. Colfax's words, and please listen to my words. We need to stay the course. If you're with members of your household, that's fine. But now is not the time to have large picnics, large gatherings. Even though the weather's great, and I know everybody's a little bit anxious about being in the house, we have to stay the course, and we have to do what's being asked of us by the medical professionals and what the data is telling us. And the data is telling us that social distancing works, face coverings will help prevent the spread of this virus, and we have to continue to do that. So please, we're asking, and again, I want to reemphasize, we had a team of officers this weekend dedicated just to address the issues at the parks. And we will continue to do that, and we'll add officers as we need to make sure that we stay the course on there. So you will see us out there. You will see us engaging just like you did last week, but we have some challenges, and we have to get through those challenges in a safe and thoughtful way to make sure that everybody stays safe and healthy. I think San Franciscans can take enormous pride in this response to this point, but we have a long way to go. And as Dr. Colfax and the mayor has said, please follow the public health orders. Now, I want to again explain the San Francisco Police Department's posture on enforcement, and what you've heard me say is a progressive compliance pathway. And that begins with education, and next we ask for voluntary compliance, next we warn, and if that doesn't work, we cite. And we have begun to cite individuals, and that is an option of last resort. And it's not something that we want to do, but if we have to, we will. And I think we've shown that. But please, again, we're asking for voluntary compliance. This pandemic has been tough enough on us all to this point already. We don't want to make the situation worse, and don't make it worse for yourself by not following the public health orders. We know this is new for people. We also know in many ways that as we reopen and slowly and gradually try to get back to some sense of normalcy, that there are going to be many questions and many uncertainties. And that is why our officers lead with education. We expect questions, and we're happy to answer those questions. That's why we have disaster service workers out assisting us with educating the public. And that's why we give everybody a chance to understand what we need to do before going to a level of more aggressive enforcement. And we'd like to continue to follow that model. And as the mayor said, the city is prepared to do what it needs to do to keep people healthy and safe. So we don't want to be enforcing a park closure. We'd rather continue to do it the way we've been doing it, allow people to go out, get some air, get some exercise, have a good time, enjoy these great places in our city, but we have to do the right thing in order to be able to continue to do that. As far as our enforcement, we are now up to 21 total citations that we've issued, and the breakdown is 11 businesses and 10 individuals. We've also admonished 57 businesses and 45 individuals, and as I said, there have been hundreds upon hundreds of informal warnings and education provided to members of the public, and that will continue. As far as our crime this week, another week of reductions in property crime. We were down 24% over the last week, and our violent crime was up slightly. That includes several shootings that I mentioned at the end of last week, or last Wednesday's press conference. We did have another shooting in the Mission District that unfortunately a person was hit and struck, and we believe that person to be an innocent bystander. Unacceptable. Unacceptable. Now, the San Francisco Police Department, we're working hard and doing everything that we can to solve that particular crime and bring that to a successful resolution. But we need your help. We need your help to report crime when you see it. We need your help if you see people that are out doing that type of violence in our community. Call 911, please. Call, provide a description. We will be there to assist, and we will be there to take action. If it's a non-emergency or crime that's already occurred, particularly a property crime that's already occurred, you can call our report number or non-emergency number at 415-553-0123. You can also call 311, or you can use our website and make those reports online. We do have a call center set up to take reports, which is allowing us to be more efficient in our use of resources. So please call us and report these occurrences as you see them. With that, I will end my comments, and thank you again for your cooperation, and let's stay the course.
Thank you, Chief Scott. The first questions are for you. Okay, Chief Scott, this is from Dominic Fracassa, San Francisco Chronicle. Has SFPD registered any uptick today in terms of inappropriate behavior, like individuals or groups defying the stay-at-home orders?
Well, what I just mentioned, Dominic, was what we're seeing. And again, by and large, people are compliant. When I got the feedback from our officers, we had a detail set up just to work on this issue over the weekend, and the feedback that I received from the officers is that when they engaged, by and large, people became compliant if they weren't. And so we're happy to see those results, and that's why we're out there. We expected to see more people out this weekend, and we did, and that's why we stepped up our deployment. But by and large, people are compliant, but there are some that aren't, and those, in the worst-case scenarios, we've issued citations, and we will continue to do that. But we hope that people respond to our education, our engagement, and if they're not compliant upon officers contacting them, that they immediately fall into compliance, and that's what we're seeing.
Thank you, Chief Scott. The next questions are for Mayor London Breed.
right.
Okay, this question is from Lily Tan, NBC Bay Area. Madam Mayor, Governor Newsom said Phase 2 could start as early as Friday. Does San Francisco plan to follow the governor's proposal to possibly reopen on Friday?
I want to be clear, we are definitely going to be working with the governor on phase 2 of looking at what retailers can be open, but we will do that in collaboration with our county health officers so that we can ensure public health and public safety as we begin to implement opening procedures for various retailers. And we're really excited about it. And we want to see people get back to work especially, but we want to do so responsibly.
The governor also said for places less heavily impacted by COVID-19, Phase 2 would include reopening of restaurants with social distancing measures and other safety practices in place. Will San Francisco be able to reopen some restaurants in the city as early as Friday? If not, has the city been able to negotiate with landlords as far as rent relief for restaurants?
Again, I just want to be clear. I would love nothing more than to open restaurants and go to a restaurant myself right now, more than anything. And I look forward to the day when we're able to do that. But I want to be clear that whatever is decided as it relates to reopening efforts, we have to do so responsibly. So, for example, we're talking about new guidelines for restaurants now. We're talking about new guidelines for gyms and other places. But can we say definitively that those businesses are going to be open this Friday? No, we can't, because it is important that we rely on the facts, we rely on the data, we rely on the advice of our county health officers so that as we push to do these things, we do so responsibly. And we want to also give these businesses time to know exactly what's expected and also to know what are the things that they need to prepare for as they begin to reopen. Because one of the conversations was centered around whether or not they can have the capacity that they once had. And what does that mean for their workforce? What does that mean for getting people back to work? So it's a little bit more complicated, and the goal is to do it and to do it responsibly. Whenever the opportunity presents itself to open anything in this city, I am going to be the first one to make sure that it is announced and what we need to do to ensure public health, because the last thing we want to see is the time that we've already spent on this lockdown. We don't want to see the city go backwards in terms of our numbers and things get even worse. So I want to make sure that we are striking that balance.
Madam Mayor, the next question is from Joyce Cutler, Bloomberg Law. How much will San Francisco seek from the state to backfill lost revenues?
Well, to be clear, we are going to do everything we can to get as much state and federal money as we can possibly get. Because right now, what we're doing in redirecting our existing resources to help manage and pay for this is very costly to our city. It is going to be a contributing factor to our budget deficit. So we are going to do everything we can to get as much money as we possibly can from the state and from the federal government. We've received a payment so far that is just a fraction of the cost of what we've already spent, but we're going to do everything we can to get every single dollar.
The next question is from Janie Har, the Associated Press. We're entering the 8th week of the regional stay-at-home order, and the Tenderloin is crowded with tents and people. What is your reaction to the lawsuit filed by UC Hastings Law today to enforce social distancing in the Tenderloin, and how quickly do you plan on addressing the issues there?
Well, again, let's just be clear. The challenges that people are experiencing in the Tenderloin, the challenges with people who suffer in some instances from substance use disorder and mental illness, they don't just go away because there's a pandemic. And I don't think it's helpful that, we have people who unfortunately are taking this route rather than trying to work with the city to resolve these issues. They are so complicated and so frustrating. When you think about the history of our city and the challenges with homelessness, think about it. Every mayor has tried to solve homelessness. And the fact is, it's not as simple as just providing housing. Housing is a critical part of it, but there are so many people with so many complicated issues. And law enforcement alone, social work alone, all these things that we invest money on, which actually has been very helpful in supporting a lot of our homeless population, those things are a collaboration, a way in which we try and propose solutions and how we work together to do it. Easier said than done, but the good news is this week, I think the end of this week, we expect to release a block-by-block plan specifically targeted at the Tenderloin. And what it does is it looks at the details of what we're going to need to do to push for the social distancing, the pit stops and the wash stations and the handout of masks. I mean, we've done these things over the course of the past couple of weeks consistently, but sadly, there's a real challenge in trying to force people who are exhibiting what is not appropriate behavior during a social distancing period when we're trying to keep everyone healthy. A law enforcement component is not the only thing that's going to work in this case. And so this detailed plan and what we're trying to do in order to address the challenge of the Tenderloin, I'm hopeful that it will work. Because it is a challenge and will continue to be a challenge, but we're doing everything we can. And we also have to make sure that the workforce of our city that we're asking to go out there, including our paramedics, our police officers, our nonprofit service providers, our homeless outreach team, our social workers, our healthcare professionals, all these people who are on the front line every single day, it's important to make sure that they are safe, that they are protected. Because when they're out there, you think it's as easy as saying, here's a mask, can you please put this mask on? There's a whole argument that occurs. And then there's a request around, wait a minute, sir, can you keep your 6 feet distance? And just imagine being out there, trying to help someone who's, lunging at you or who tries to spit on you or who's not following the order, and all you're doing is trying to help that person. So there's more to this than we're going to be able to open up all these hotel rooms. We're going to be able to clean up every single block. The Department of Public Works, the different folks who work for that department who clean the streets every single day, they're out there every single day, especially in the Tenderloin. People who are specifically picking up needles and cleaning up after grown people. People who are adults who should be cleaning up after themselves. So I get that everyone wants to see something different. I want to see something different, but we're not housekeepers, we're not babysitters, and we're being treated that way by people who have some challenges in some cases and some difficulties, and some who are just downright defiant. So let's give the people out there who are putting their lives on the line some credit for the work that they have done and continue to do despite the disrespect that they get when they're out there every single day.
Thank you, Madam Mayor. The next questions are for Dr. Grant Colfax.
Thanks.
Dr. Colfax, this question is from Loy Almiron, Mission Local. It was mentioned last week that after the testing in the Mission, random testing in the Bay Area would be done as well. Can you provide more details? Are there any planned big testing efforts being planned like the one that was conducted in the Mission?
So as we move towards universal access for testing, the announcement today that any essential worker in the city can get tested regardless of symptoms and for free is an important component of our broadening of testing. I think with regard to the Mission study, it's important to emphasize that this is a research project. has been led by UCSF in collaboration with community stakeholders in the mission as well as with the health department. That very important work and the results of that work will help inform our program. The discoveries of that research will help inform our ability to strengthen our testing both in the mission as well as in other communities at risk in San Francisco. In conversations with the UCSF investigators, there are lots of ideas about how the work of that study could be done elsewhere in San Francisco, and I know they are talking with a number of key community leaders and stakeholders about where that type of research could be done next to, again, help better inform the health department's testing strategies as well as other provider strategies across the city. So certainly we're looking at that work, and then we're also collaborating with UCSF researchers and other institutions across the Bay Area where research is being done in communities and extensive testing is being done. How does that help better and best inform our programs moving forward to develop our culture of testing and to ensure that there's universal accessing for testing for all in San Francisco?
Thank you, Dr. Colfax. The next question is for Director Abigail Stewart-Kahn, Homelessness and Supportive Housing. Director Stewart-Kahn, your question is from Mel Baker, San Francisco Public Press. Mayor Breed has said that homeless who come to San Francisco from other communities are not eligible for hotel rooms if they are infected, and the Chronicle has reported that there are people who have come to the city hoping to be housed in hotels. How many people does the city believe have come here for that reason, and how will the city determine when an unhoused person is eligible?
Thanks for the opportunity to clarify. I know there's been a lot of coverage around this. So generally speaking, before COVID-19, we know that approximately 30% of individuals experiencing homelessness in San Francisco come from not from San Francisco, or where they became homeless was not San Francisco, which means that 70%, which is the vast, vast majority, excuse me, are from here originally and became homeless here. And so it's really important that we not contribute to the concept that homeless folks aren't from here. They are. They are natives, or they've been here a very long time when they become homeless. What we know anecdotally that we are hearing from people who are unsheltered on our streets right now is that they are not from here. And so what is very important to me is that those individuals who tell our system of care, I was told I could come here and get a hotel room, that they hear the message in a very clean way, because I think it's very important for us to be honest with our homeless neighbors, which is that if you were not known to our system of care before COVID, meaning you are not part of receiving services and in our databases, then you are not first on the list for the unsheltered hotel rooms. And this is not because we don't care about you. This is because there have been people who've been waiting here in San Francisco, known to our system of care for a very long time. And we are rapidly expanding our hotels, and in fact, we've opened more hotels than most communities in California, if not all, but we need to figure out where to start. And the city has chosen to start with the people who have been here before the COVID pandemic, who've been waiting in some cases for 10 or 20 years to receive support of this kind. Thank you.
Thank you, Director Stewart-Kahn. The final question today is for Director Mary Ellen Carroll, Department of Emergency Management. Director Carroll, your question is from Ida Mohadad, San Francisco Examiner. Which school facilities are being considered as safe sleeping sites for unhoused residents, as urged by the Board of Supervisors and the Board of Education through recent resolutions?
Thank you for that question. Over the last 2 months, we have seen an increase in and a rise in encampments in the city throughout San Francisco. And we have implemented a number of mitigations in order to address this crisis. These include establishing 120 shelter-in-place RV trailers for people experiencing homeless in District 10. We have an ongoing program of shelter-in-place hotels for our unsheltered vulnerable populations. We've expanded our meal program for those living on the streets, and we've also expanded restroom and hand washing stations throughout the city. What we're doing now is through the EOC, the Emergency Operations Center, and in partnership with the Department of Public Health, the Human Services Agency, and housing and supported homelessness and supported housing, we are connecting individuals to experience homeless with the most appropriate solution. We are finalizing the evaluation of safe sleeping sites and plan to announce those sites and when they will be ready in the near future.
Thank you, Director Carroll. This concludes today's press conference.